right, well, might as well get started. I'm very excited for today's discussion. As you can see, we're not taking a deep dive into a paper today. We're not doing a literary review. This is a special edition of the COVID-19 Journal Club, and we have 4 terrific panelists to discuss today. Kind of going on the running title of public health messaging during COVID-19, and I can think of no better people to talk about it. First, from Drexel, we have Dr. Michael LeVasseur, an assistant professor of epidemiology and biostatistics. And we have Professor Jennifer Kolker, who's an associate dean for public health practice, both at Dornsife. And of course, what would a conversation about public health messaging be without those who disseminate it to the masses? And we have 2 absolutely wonderful journalists joining us today. First, Tom Avril, who's a reporter for the Philadelphia Inquirer and has been so for more than 2 decades, writing about science and health topics since 2001. He's a former math teacher and engineering major, and is actually also participating in an NIH trial measuring the seroprevalence of COVID-19. And his terrific writing is, of course, available at Inquirer.com and sometimes carried by other news outlets nationwide. So I would encourage anyone to sign up for the Inquirer if you haven't actually done so already, because it's terrific writing. And we also have Wendy Warren joining us. She's an award-winning director of integrated media at NBC 10 and Telemundo 62 here in Philadelphia. She oversees all content across 21 platforms. Wendy, I promise I will not ask you to name them all, but there's quite an array between mobile apps, social media, and OTT TV apps. In her more than 25 years in print, digital, and television journalism, Wendy led or joined a number of collaborative projects and content partnerships. And when she is not crafting app alerts, she's texting with her daughter, who's graduating college soon, and refereeing her 2 feuding cats. So we'll probably talk a lot about how our day-to-day has changed, and I'm sure that's certainly part of it. So, of course, I don't need a huge lead-in about why we're here today. There's obviously one topic on the minds of everyone in this country, and of course, the pandemic every day changes very quickly. Yesterday marked the highest point we've been in terms of number of hospitalizations for COVID-19 nationwide and number of overall cases, number of overall deaths. And that's pretty gloom. So that's more sobering. But of course, there's some reason to be optimistic. We have 2 vaccines that look very encouraging, and I'm hopeful that we can at least leave on a somewhat optimistic note, but we'll find out. At the very least, our conversation will be based in facts and science, and we'll all be better informed by the end of this. So I was hoping to kind of start our conversation by talking about how reporting has changed so much during the pandemic, and to see if Tom and Wendy can kind of give us the context of how the daily rhythms of a newsroom have changed and just how overwhelming the pandemic has been through day-to-day reporting.
Wow, that's a big topic. I think that, we all have been at home like so many other people in so many other professions, or at least those who are able to, and I consider myself lucky in that regard. The old style newsroom, as Wendy knows well, would be you'd be sitting next to a bunch of people and something would happen and people would holler out and say, "Hey, did you hear about this?" And someone would be right on it. Someone would dash off to the scene of whatever event was going on. And, it's not exactly like in the movies, but it was something like that. So now, of course, we're all hunkered down in our home offices. And it isn't quite the same because, ideally, as you said, Greg, I write about science and health. So ideally, I'd like to go to the lab and have the researcher point out the results on their Western blot, or if it's not a non-life sciences, some other type of scientific equipment. And you really miss something by not being there in person. And I have on occasion gone out, wearing a mask, but it's not quite the same. So it's a lot more reading and a lot more talking. and Zooming, but we seem to be making it work.
Yeah, I think I would really second that. You know, so I work in television, and, you know, the thing we do is we go out on the street and we interview people. And that has literally become a risk to our crews in the field. So that's why you see odd things like the long boom mics, that if you're watching somebody interview someone else, there'll be this long mic. Or having people wear masks on TV, which is not, you know, believe it or not, like that's a big deal. You know, the idea that you would have someone that is trying to make a personal connection with you wear a mask was a very, very, very big step. But it was also a step we wanted to make sure that we were underscoring the importance of masks. So, and there's been a lot of conversation around that. I think one of the other big changes for us, and maybe Tom, you've experienced this too, we've never had a public health situation like this. And I think it has somewhat led us to adjust in real time some of the rules around health reporting. You know, for example, how much information is it appropriate to share with the public? And, you know, how do we describe someone's COVID status without stigmatizing it, without over dramatizing it, but also without under dramatizing it? You know, what kind of health statistics are collected on a regular basis and how are they disseminated? You know, these things are kind of getting worked out in real time.
Yeah, I think those are all really critical points. And that was actually one of the questions I was going to air out to the Drexel end of our panel, because I'm sure you're immersed in the world of news and you've both done countless interviews since this pandemic has started. Are there some running frustrations you've had with some reporting or things that you might do differently?
I don't think frustrations, actually. I mean, of all the things to be frustrated with right now, reporting in media is like at the bottom. So I think it's challenging. It's just really challenging to say, sure, I'll take this interview and try and figure out what's the messaging. I think part of what's hard, you know, I'm not an epidemiologist. I really speak much more to sort of the policy and the practice and kind of the implications of things. You want to learn about R0 and you want to learn about other stuff, you go to Mike. So sometimes it's hard to know until you're in a conversation with a reporter, what's the pitch, what's the message, what's the frame? And then so, you know, that's why so I guess in terms of frustration, that would be one of the ones where it's sometimes tricky, because sometimes we just are who's available. And then you're halfway through an interview and you realize, I am so not the right person to be doing this one. It should have been someone else. So, and at the same time, we recognize you guys are like deadline, real time. We don't have a couple weeks to figure out who's the best person to talk about this. So I think that's probably one of the biggest challenges, at least from where I sit. Mike?
Yeah, and I remember early on, just to piggyback off of that, I think this may have been back in May. I honestly don't even remember when the mask mandate went in order in Philadelphia, but it was around the time that happened. And I was asked to do an interview on camera for, I don't even remember which group, but they were asking me, like, you know, which material is best for a mask, and I was like, that's an engineering question. Like, that's not. I don't know. That's material science. I have no idea. And they were like pressing me for an answer. And I was like, I have no idea.
I like the blue one, right?
Yeah, the blue one's cute. You know, is silk okay? Is this okay? And I do not have an answer for that. But I think there have been other times, you know, I'm really immersed in the data. I'm not just an epidemiologist, I'm also a data scientist. And so I know all of the limitations of the data that are shown every day on national TV, on local TV. I know their limitations. I know that you can't compare what's going on in Florida to what's happening in Georgia, because they're reporting in very different ways. And so, like, when they're talked about as though they're comparable, I just kind of like put my epi hat on and I'm like, well, yes, that's true. That's probably what's happening. But like, definitively, this isn't exactly what's going on. And so that's been a little bit of frustration. I think the third thing that I experienced, and I see Neil Goldstein, my colleague, is also watching this. We were interviewed for a radio thing on how to keep safe for Thanksgiving, and this was back in October. And I know when I was talking with the reporter, you know, the plan was to have this air on Thanksgiving week. And my only response was, there is no way to have a safe Thanksgiving. And that wasn't the messaging that we were all doing at the time. He was like, yeah, but people are going to do it anyway. Like, how do we get them to do it safe? And I'm like, but just don't do it. And so it's hard to like have that kind of conversation. It's like, yeah, I'm sure, you know, everyone wants a way out, but there isn't one. Just stay home.
Yeah. I don't know if Tom or Wendy want to piggyback on that. I always like to ask reporters if there's one glaring mistake that they see communicators like me make, or seeing researchers make who have done a ton of interviews for the first time in their lives. We've all seen a lot of really bad Zoom backgrounds.
If I'm sorry, I didn't hear what you said. What did you
Are
say? Mistakes did they make?
Yeah, well, any ongoing challenges you had, either with experts that you've interviewed or with, you know, PR people like me, for example, of either not knowing about your deadlines and the time constraints you're in, or what other, you know, misconceptions do they have about?
Can I just jump in before we even get into the nitty gritty and say a huge thank you? I mean, we got to start with, yeah. I mean, if it weren't for public health professionals leading us by the hand through this, we would not be able to do any of our work. So, you know, I really, really want everybody to understand how much we appreciate a faucet of information. We are physically getting phone calls from frightened people, and having you help us is huge. So I'll start there.
That's
and then we
nice.
get specific.
That's great. We're recording that, right?
I mean that. I think one of the things I'm thinking about is I manage a lot of journalists, and our lack of information around public health really hurt us in this. I think one thing to keep in mind, you guys are able to be such specialists, and that's so useful. But if you're not Tom Avril, who, you know, is a huge byline, you're probably a generalist. And so the reporter that you might be talking to it does not have the background that they probably should have in public health.
Can I jump on that one, Greg? Because it's really important. I actually I watched pretty much every single one of the city's back when they were daily pressers. Now there's, thank God, only weekly. So I would say back that it's been amazing and impressive to see what, you know, to watch the Philadelphia Press Corps work. It's just been interesting, and it's really been interesting to see how much people now know. But it struck me at a couple moments, going to what you're saying about how much work we have to do around public health in general. You know, my big fear is we get a vaccine, we achieve herd immunity through a vaccine, this goes away, and everyone's going to forget. And when I think about where are we at some time, I think we need to go. And I was in Philly working with the press at the beginning of the HIV epidemic. And it was, so how do we go when we can take a breath and we're at a little bit less of a crisis? Is there room to go back to all of you, to go back to the beginning and talk about public health and what it is in a way that, you know, sort of backfills some of the knowledge that you're all having to get, or many of you are having to get on the fly, but only related to COVID, because there's a lot of other stuff out there as well.
And I think one of the big, I don't want to say problems, I think this is one of the wonderful things about being public health, but when we're doing public health right, no one has any idea we're doing anything at all. And so like pointing out that like our vaccination programs, are the efforts that we do in vaccination, you know, sanitation, the messaging that we do for you know, safer sex and you know, all the other things that are just a part of our daily lives. I think that, you know, there was a campaign a few years ago from the American Public Health Association, the This is Public Health movement, and you would put a sticker on anything that looked like public health. And it's a big field, and there's a lot to talk about, but I think a lot of people don't realize how impactful public health is.
That's great. One quick note to anyone watching as well. We have a bunch of questions and a lot to cover, but if you'd like to throw a question in there, use the Q&A button at the bottom of your screen, and we'll try to work in as many questions as possible if there's other thoughts that we're not addressing. So,
Tom, Greg, I think we hijacked your question, which was about the challenges.
No, that's great. When you're talking about a pandemic, as much positivity as we can, you know, get is great. especially because I'm about to go a little negative again, but how do we, lots of us obviously trust true journalists, but some of us don't. How do we work together to restore trust in journalism and in public health among those who have kind of lost it? And
one of my kind of dark humor jokes in the newsroom is that the invention of the internet was a really bad idea. I don't truly mean that, of course, because it's been an incredible tool. I mean, we do things now that we could never have done before: gathering data, finding the sources to talk to, watching animations from scientists, epidemiologists, and all of that great stuff. However, as we all know, you better than we do, people tend to congregate in these dark corners of the internet and spread just ludicrous misinformation. I mean, alarmingly and dangerously ludicrous information. And I'm not sure really how we get back to that. It's a challenge. I did see one recent example. Some of you probably know Michael Mina, one of your counterparts at Harvard, and they've been doing these regular briefings every so often, for the media, and he's also taken a big presence on social media. And Elon Musk, the guy behind Tesla, he made some sort of a semi-crackpotty claim, and I mean that in the nicest possible way. And rather than just, and he directed it at Mina, the Harvard guy, and rather than to shoot him down and say you're an idiot, which he was effectively being, despite being a smart guy, Mina said, well, that's interesting. I can see why you might think that, but let's think about this evidence, and it's reasonable to ask this question. However, blah 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 blah. And I wish I could remember the exact example. And so rather than get his back up and say you're fake news, you scientist or have an agenda or something, instead Elon Musk retweeted the response, and so gave it some measure of legitimacy to an audience that might not otherwise have responded to it or accepted it. So does that work? I don't know. I mean, if people are willing to listen and you're willing to engage them halfway, then maybe that's the answer. But I'm sure Wendy struggles with this as much as we do. I mean, there are a lot of people who simply don't want to hear it.
Yeah, we're thinking about this right now as we head into a potential vaccine, and knowing, that it's not just one vaccination that would probably happen, but probably two. And, Americans can really, their attention can really turn in between those two vaccines. So, I don't have an easy answer for this. This is probably one of the most existential problems that all journalists face. I do think it's worth saying that, there have been attacks on journalists around this. It's not nearly as bad as, what, say, election, officials are dealing with, but it has happened, and it's happened to our crews. Someone recently spat on one of our crews. So it's real, and you should know that only as you're dealing with these folks, and and we appreciate your support, but also we're trying to make sure that we reach the reachables. And I think one of the most optimistic data points I've seen on this is the difference between the number of vaccine hesitant people and the number of vaccine denier people. That vaccine hesitant audience, I think, is reachable. But as Tom was kind of saying, the tone that we use is going to be so important. One of the frustrations and one of the things we hear a lot is, but you told me something else, 6 weeks ago. So one of the things we're trying to do in the tone is to say, this is where we are now. This is our understanding now, and this is a fluid situation. I think every time that Dr. Farley says, I know this is difficult, things change, because things do change in the course of a pandemic. I think that's important. I hope those are helpful.
Yeah.
And I would say that I think we have the same obligation, right? So we also, in public health, we think we are very smart people. And we think we're very smart, and we know we're smart, and we don't always do a good job of sort of stepping away from our smartness and recognizing that it's not just about being smart. And I think this vaccine thing is a perfect example. We talk everyone in the public health community talks about anti-vaxxers, which is very different, especially now, than very valid reasons for distrust of a vaccine that was developed at this particular time in our political history. So we need to make sure that we tread that line carefully, because if we just say, if you're hesitant, we don't want to talk to you, we're only going to talk to the embracers, we're going nowhere fast. And so I think we need to figure out the messaging, work with you all to help with that messaging, and then hear what comes back and adjust as we need to. I'm sure Mike has way more to say even about that.
Well, I mean, I think I just have one minor thing, but it might be one of the most important things to keep in mind is that not only was this vaccine developed at such breakneck speed, but it's also a brand new technology that has never gotten past clinical trials before. So even those people who might be more aware of, the science behind vaccination might be like, oh, well, this is the first time we've used mRNA technology for a vaccine at a large scale like this. And may not trust that it's going to be helpful. My question, I have a large number of friends who want to wait and see what happens when everyone else gets the vaccine. It's like, what are you waiting for? Like, what's your time point? Is it going to be 6 months if you don't see a lot of, or is it going to be 7 years? And where are you going to be looking for that information? Because I think my concern is that there's going to be a large swath of people, around 60%, I'd say, based on the polls that I've seen, who are going to be waiting to see what's happening. And we need to reach that 70% mark if we're going to be able to go back to the bar and go out to restaurants and have our celebrations. We all need to be in this together, which is a phrase that we've been saying for 9 months now. And let's just be in this together. I don't know. I'm tired.
Can I piggyback on that, Mike? The other thing that we're dealing with, I represent both NBC 10 and Telemundo 62. And I think that the sort of hesitancy denier kind of dichotomy or whatever relationship is totally different in other languages.
Sure.
And the surveys that I've seen indicate that folks who speak other than English are really being left behind when it comes to the messaging that you're talking about.
And that's hugely important. And certainly not something that I have thought about. So thanks for bringing that up.
Yeah, I mean, I saw even reports today that Facebook has agreed to take down some of the misinformation about the upcoming vaccine. And we'll see how that plays out and how effective they are at managing the onslaught of disinformation and misinformation on their platform, as well as so many other social media platforms, right, Wendy? Yeah.
I actually got an email today from someone complaining that their vaccine post had been taken down off Facebook. And I was like, yes.
And I think so much of it is conveying empathy. We're talking about really fundamental communication topics, right? Mm-hmm. How do you define what liberty is? How do you define freedom? How do you define all of these things? And you all obviously have your work cut out for you.
And the basic messaging, Mike, as you just said, the fact that it's not an individual choice. I mean, it is to some degree, but if enough people don't do it, then for those of us that do it, it's not going to matter, or it's not going to matter in the same way. So there is a role for not forcing your friends and family to get it, but there is the other piece of how do you get people to communicate with their people the same way that you communicate with your people about wearing masks or about canceling Christmas and that stuff. Because if we don't collectively get to a certain number, it's not going to work.
And we do need that buy-in from the public. And so I want my friends who are, in a variety of fields to go out and get the vaccine and then tell their friends and family about, well, this was my experience. And I got a little fever and I was tired for a couple of days. And then I went back and got the second shot and I had some side effects, but otherwise I was fine. Or it was debilitating and I needed to take 2 days off of work, but I'm glad that I got it done. And just to have that open communication in the general public, I think is going to be very helpful for getting people to sign up to receive the vaccine.
One thing that I've kind of wondered about when you talk about the disinformation and the misinformation is what role do public health researchers and what role do journalists have in either combating these? Do you address some of these comments? Do you just let them go, and kind of, at what point do they become so big that they need to be addressed, either through traditional reporting or responding to them right then and there? The strategy's tough. I guess Tom's pretty active on Twitter.
I mean,
what's your take?
It's interesting. A large segment of the audience seems to have disappeared to that new platform. I don't even know how to pronounce it. Parler or Parler. Have you seen?
Yeah.
And I'm not
Twitter, right? Or sort of.
Yeah.
It is.
I mean, I get a fair amount of emails from readers, many times saying, "Oh, this was great. You finally explained something I didn't understand." But unfortunately, more often saying, you know, you're a shill for pharma or some other nonsense, and and I just have to be polite and say, well, okay, same thing like the guy was doing from Harvard. I can see why you might think that, but in fact, no. And try to be brief and polite. We're told that we have to respond to all reader emails. I mean, so I try to.
Wow.
There's been, but actually, there are fewer now than there used to be. And now people are more likely to either comment on a Facebook share of an article, and there I just don't even bother because it's impossible. I mean, you get a line or something to respond, and there's so much either misunderstanding or vitriol that it's like beating back weeds. Or they might comment on the bottom. As Wendy knows, you can often comment at the bottom of articles, and that's it might work, it might not. There will be sometimes problematic articles that they will simply turn off the comments. I mean, anything where race is mentioned, that tends to go off the rails almost immediately. And I just feel like, great, turn off. Why do we invite that? But you try to be as patient and respectful as you can where it's appropriate.
There's some research out there that says that trying to smack down misinformation online can actually amplify it, which I'm sure that's true, but I can't completely buy that. And I do think that the pandemic gives us a little bit of a life lesson in how to maintain a slow and steady, empathetic, I love that word, approach to communicating to people. And you can't consider one battle a win. You kind of have to try to keep focused on the war and really just keep this flow of, no, here's the information, here's the information, here's the information. In terms of, something that is spreading in the community that is really wrong, that you want people to know is incorrect, I think that is a valid story. I just think that doing it the right way is really important. Unfortunately, a lot of our viewers right now think that NBC in particular has an agenda. And so they're going to see anything that we communicate as part of an agenda. So the goal of our interviews and the goal of folks that we interview should be showing, nope, we're just sticking to the facts. This is the evidence. These are the statistics. Now, that can be hard to do in visual media. I know that. But we are still, I think, raising the point with, say, an interview of someone who is interviewing you that, hey, I've actually got some good backup for this. How can I give it to you in a way that you can express it so that it's not, too much for the viewer? I think that would be a really good thing to say. I've got something here, but I need to make sure you can present it easily. And that would be a good way to open the conversation. So it's not just your reputation, it's not just your learning, it's also, here are the facts.
And I really am glad that you made the point that you won't reach everyone. And when it comes to vaccines, when it comes to anything else, that as many people as you can reach is great, but you don't want to bend the facts. You don't want to bend the truth. You need to keep it straight.
I also think it's important, you talk about people not trusting the media. Well, I don't know, do people distrust the media less or science less right now?
Yeah.
So in some respects, I think there almost needs to be some push between the media and us, because otherwise the public is going to think we're all just in cahoots and not trust anything that we say. And so, and again, I started my public health career at the beginning of the HIV epidemic. And when I was in governmental public health and media, you guys were like the arch enemy. But in some ways, you pushed in a way that was important, and you pushed then government to become more transparent. In this, everyone's been playing together so nice, which is great. But then I wonder sometimes then, does that make us look like one, we're all playing together so nice? And so that if you're the public and you lean toward distrust, like you want to know that the media is going to push. It's going to push the mayor on some of these things. It's going to push, Dr. Farley, well, you said this, but the data's saying this. Why are you saying that? Or you said there are these many testing sites, but I picked up the phone yesterday and I couldn't get an appointment anywhere. So I think that, it's easier for us, certainly in academic public health, when we're all playing nice, and it's always hard to get that hard phone call or to be pushed or to be put on the defensive. But I think we need it sometimes in order, partly because it's what gets good information out there, but it also engenders trust overall when people see that, we're not just playing it, we're not all in cahoots.
I think one great point is, of course, the public health messaging standpoint and convincing people to follow sound public health advice. But another important aspect of this is influencing those policymakers and public health officials for the city health department or anyone else like that. How do you combat the conspiracy theories? If you even do that, how do you reach the public, but also focus those efforts on, influencing messages coming out of the city health department or whatever other guidelines actually influence public health? So there's the public health messaging, but also the policy angle, right, Professor Kolker?
Right, it's all of it, and we're speaking to different messaging, and that's where the media is really important, is sort of what's in knowing sort of who's the audience and who's reading it and who's doing what.
One thing I know we talked about briefly earlier was how do you convey and define definitions of R0 and the K dispersion of the coronavirus and all of these things. And we got a great comment and question from, Dr. Neil Goldstein, who we mentioned earlier, that he says that often reporters are looking for a good soundbite. And he's been really grateful for reporters like Tom, who he's talked to, I'm sure, and actually understand the science. And that they don't agonize it in quite the same way that a lot of researchers agonize over it. And it's just a matter of getting a clear and concise and simple soundbite. Because the reporter already knows the story, has already written the story in a lot of ways. It's just a matter of putting an authoritative voice in the story, right? So, Tom, could you speak a little bit to that?
Oh boy, don't ever assume that I know the story. That always cracks me up when someone will say, well, what's your angle? And I'm like, I don't know. I'm going to decide what to write. I don't have an angle per se, but I'm going to decide what to write after I talk to you and 5 other people. So I'm sorry, what was the question?
About being grateful that there are times that you understand the science and just
I see. Yeah.
Very concise soundbite, because it's even more important on TV, and we'll ask Wendy about that, I imagine. But
I can't even imagine. I mean, whatever we do in our pages, it I would say 4 times harder to do it on the air, because they have to distill it to its essence even more. And I just can't even. I mean, I worked for a TV station 1 year, and it gave me hives. It's so hard. So however easy they make it look, it's. And I know they now have 18 other platforms or 23, but it's not easy. And I think as rocky as the path has been at times, with various media outlets communicating things over the past year, it's in many ways a good story. I mean, when else can you turn on nightly news or read your newspaper and see terms like R0 or for that matter, pandemic, which I bet most people wouldn't even have known or heard before this year. I mean, these are now terms in the common vocabulary. And so I think in that sense, it's a good story. I mean, people are appreciating the work that you do and appreciating that there's not one. I mean, they're appreciating the distinction between the different academic disciplines. I mean, people maybe have this idea that doctors are all or scientists are all one giant class of people, but in fact, there are many silos and many fields of expertise. And I think even the general public is starting to appreciate that more. And also the pace at which things should be expected to happen. I mean, this idea that, oh, here's a study and that's the gospel truth. I mean, you'd be probably not surprised that many regular people think that that's it, that's the last word. And then if it suddenly later gets modified or tweaked or not replicated in exactly the same way, then, oh, well, then we can't trust anything. I mean, obviously that's not true, and we all know that, but I think that the general public is starting to appreciate that this year with all of your, and to some extent, our hard work.
Yeah, I want to kind of underscore that. You know, what Tom's talking about is, you know, the relationships that you can build with certain reporters, you know, and knowing that they do care, you know, they do want to see the latest news. That's really important. And, you know, Greg, what you guys do in terms of setting us up with various people that we get to know, that actually helps us in reporting. The other thing I think that Tom said that was really important is don't always assume that the reporter does have a set angle, because really we are trying to learn as we go. Now, that said, I think it's a really good piece of advice to understand that, yeah, we do want a soundbite. Yes, that is true. And that is what calls your attention away from making dinner and brings you back to the television to learn something. So it's a pretty good idea to think, well, if they're going to come to talk to me about, you know, how transmissible is coronavirus when you're eating outside, what is the one message I'd really want the audience to remember? And give some thought to it before you have the interview, because then you'll get that point across. And along the way, there's probably other things you're telling the reporter that they never knew, and that will help shape their story.
You know, that's such great advice. And we've talked for years about doing better media training at the school, because some people, I mean, I've done more media in the last 6 months than I've done in my entire career. Yeah. But I've gotten it down. Like, I've gotten a couple of those, you know, I did an interview at the Washington Post about eating inside, outside. And I had this thing about, you know, watching football and drinking beer, but who watches football without beer? And I thought it, and I'm like, that's going to make it in. Like, that's my great line. And of course it was. But as for the most part, public health researchers, we don't, you know, we bury the lead. We go, duh, we have our idea, our hypothesis, da, da, da. By the time everybody's gone back to what they're doing, we have our big aha moment. And it's you know, and there's probably now about, I would say, Mike, I don't know, 20% of us, maybe fewer, that have really gotten good at getting this stuff and gotten better also in the last 6 months. But it's something that we need to get better at.
Well, Dr. Kolker is very good at it, by the way. I mean,
but it's something that, because there are other people. And I think that idea of like being able to, you can't get everything out there. We've got to think about what are the one or two really important things. And that's so hard for a scientist to do, because it's all important. For us, everything matters.
Yeah, and in a lot of ways, the kind of work that we do, especially in epidemiology, we're trained to not believe our own research a little bit. Like when you look at the discussion section of a paper, it's usually the largest one, and it's all like, yeah, this is what we found, but these are all the reasons it's probably not true. And other studies need to really look at this to poke the holes in it, because that's how science works. And so when you're going to the media and they're like, how do you know, what is this thing? What is the truth? And you're like, you know, like aerosol versus droplet, like it's really a spectrum. Like it's so much more nuanced than one little soundbite. And then, you know, I've got people saying, well, how come, you know, we can have outdoor dining, but we can't have the gyms open? And it's like, but the transmission dynamics are actually different in those two settings. And that message isn't getting across somehow.
It's really hard. And don't be afraid to tell the reporter, this is a little complicated. Let me tell you what we know now. It at least signals to the reporter who, you know, is thinking about, my editor needs a script, you know, in the next 20 minutes, you know, that you need to take a second and spend some time on this.
I was in a radio interview a couple of months ago out in Cincinnati, I think. And it was sort of like, you know, four not shock jocks, but for reporters in like drive time, I think is what it's called. And they were asking me about, the masks and everything. And, they were like, how come this information has changed so much over time? And I said, science changes over time. Like, that's just what happens. And they came back to me with, that's unacceptable. And it's like, I'm sorry it's unacceptable to you, but it's just how it works.
Yeah. Yep. That's a great answer, by the way.
Can I ask a question? Can I jump in, Greg, and ask questions? It's really a question for media folks, because I don't know how any of this works. But one of the things that I think has been fantastic, and it's building over years, but particularly with the coronavirus epidemic, is the use of infographics in addition to narrative prose or interviews to really show things. So some of the stuff, Mike, that you were saying about, like, why is a gym different than a restaurant? You've seen there've been just some great things that have come out of various health departments, and we've done some stuff at Drexel that just put it in a great picture. And I don't know, like, Tom, when you write an article, I'm assuming you don't also do infographics. Like, are there people at the Inquirer who could do something like that? Or do you put stuff? I only read it online, so I don't get to see even what's in the print. So just curious how we can, because that to me is really the place where you can make a difference in people going, oh, that's how you wear it. That's what they mean when they say, make sure the mask goes over your nose.
Yeah, no, I agree. I mean, the reporters have been trained to do kind of static images, such as your basic bar chart, but that doesn't often really tell the story. We recently hired a guy who is a video game designer, and earlier on in the year when there was when the presidential primaries were going on, I did an article on the math, or essentially the statistics of sampling a population to get a sense for how many people do you need to actually talk to get a sense for how well each candidate is doing. And because, as you know, many people, quote, don't believe polls, or they think that the reason not to trust them for one reason or another. So we worked with someone at the Monmouth University Polling Institute, and then this video game designer put together a game, essentially, and you could essentially conduct the same poll over and over again, randomly sampling 400 people out of 1 million or 500 people out of 1 million, and it would produce the bell curve. And you could see how, whatever it is, 95% of the time, you're going to end up within a couple of standard deviations of the, and I can say those words over and over again, but no one's going to get it without playing the game. And so yes, I agree with you that the more we can do that, the better. It takes a lot of time, but it's important.
One thing that I run into a lot with researchers is the way an article is outlined is almost the exact opposite of how an academic paper is. Right?
Yep.
So you have your findings up front and you have everything else below that. So it's the complete opposite direction. So it's a challenge for a lot of people to get to the point in a clear and concise way. And it's also frustrating because, a lot of researchers, you're pouring your heart and soul into this for months, usually years at a time, and distilling it down to such a finite, takeaway is certainly a challenge. And I think I say that with a segue to, we talk about the difficult concepts of public health and explaining that to the general public. How much is appropriate to tell the general public at a time like this? Wendy pointed out earlier, like, you don't want to scare people unnecessarily, but you also want them to have the information they need and know the latest science. I think let's start with Mike on that one.
Yeah, I think that that's a really good question. It's 2020. People, almost 2021. People have access to the world of information at their fingertips, and a lot of times, too much information can, I don't want to say it tends to, but can be too much. It can lead to some bad decision making, I think, without it being guided in a certain way. So, like, if you think about, this vaccine and what people know about vaccine development, and how they imagine vaccine development coming into play. If you're, talking about, Project Warp Speed, people imagine that the science was happening at warp speed, and that's not what was happening at warp speed. The science was happening the way that science normally happens. What the warp speed is is the production section and talking about the distribution. I'm sure some of the funding avenues were opened up, but not all the pharmaceutical companies bought into it. And so when you hear warp speed, and then suddenly, you know, the scientists in the media are saying, oh yeah, go and get vaccinated. And, you know, I've taken a little bit of money from pharma for a study that I did. I think it was like $4,000. I declare that. But like, I'm no shill for pharma. You know, I've gotten paid $0 for my work on coronavirus in the past 10 months. And I'm consulting with governments. I'm, you know, doing a lot of interviews with the media, and I'm doing all that on top of my teaching responsibilities, mentorship, authorship, the committees I'm part of. So I'm just busy, and I'm doing the majority of that for free. I'm losing the point for some reason right now.
But we are
how much
thankful.
do people know? How much do people know? And
But how much should people know?
Still?
Well, here, can I just say that, you know, I'm a big fan of alternative forms of storytelling. And, you know, it doesn't, so maybe the answer is more, can I do a Q&A with you? Can you go on Reddit and do an Ask Me Anything, an AMA? Can you, you know, is there any other, we were talking about the game, I think it's such a great example of that. But, you know, what are the other ways that we can tell a story? And, you know, this helps in a lot of different ways. It's clearer. People are used to it in this BuzzFeed world. You know, they're used to an alternative story format, but it even helps that story be searched better by search engines. So, you know, I think really just maybe take a step back and say, how would I reach my you know, college age kid with this information? And I might, the New York Times just did one today. Tom, did you see this, where you find your place in line for a vaccine?
My whole family just did it.
Oh, it's awful.
Was it all the way in the back?
Oh, I was like 200 million people.
Yeah, I'm pretty far back. My husband's further up. But I think that's a great point. And also it gets to the point of, we sometimes assume we know what people's questions are. And I think a lot of times we're wrong. I mean, I base it in some ways, you know, I have my husband who's not in public health at all. I have kids in high school and college. I have my family, and I'm sure like many of you, my friends are constantly, you know, asking me questions. I'm like, you know, I'm not Corona Google.
We're not.
But it's really interesting but when you do something like a Q&A format, something like that, you get, it's audience driven, it's recipient driven. And then you find that, oh, people really don't care what this is that we've been spending all this time explaining. They just want to know this. And we don't, I mean, we assume that we know what that's going to be, but I think that whole different format and letting it be more audience driven is probably really important.
I think it's been really interesting following the questions people are asking me over the course of the past year. Because very early on, it was things like, should I cancel my ex party? Should I cancel my wedding? Should I move this? Should I not do this? And, you know, the answer then was like, yeah, you should probably cancel all those things. But then it became, how do I protect myself and my family? And then it became, how do I do these things out here? And it's been a wild ride, I think. And now I'm starting to get the questions of, well, you know, I'm supposed to have a vacation planned in June. Should I do it or cancel it? It's like, I literally don't know. I don't have a crystal ball in front of me.
I think we got a really terrific question that just came in, and I will start with Wendy on this one. But seeing that the vaccine is one of the more hopeful spots of otherwise dark pandemic, how can journalists work to gain the trust of certain communities that have a lot of reason not to trust either journalism or public health in the past? Black and brown communities, inmates, perhaps military veterans. The questionnaire mentions the Tuskegee experiment. So there's a lot of, you know, distrust of vaccines in general. How can journalists work to gain that trust back?
Boy, that's a huge question. I do appreciate the fact that it was asked. Thank you, Joe. And, you know, I think one of the things that we're thinking about is it starts with acknowledging that there is a problem, you know, and that we can't just say, oh, trust us, you know, I know bad things happened in the past, but now you can really trust us, we promise. So, you know, really spending some time listening, and I think, Jen, I think you brought this up, the word listen, you know, and making sure that we are present in communities so that we can really hear what the concerns are. I think, and that's something we're spending a lot of time on, which is hard because we're small and we're usually running from place to place, but trying to spend a little more time there. Then the second thing that we're really working on is diversifying our expert Rolodex, because I think the fact that we can have the Black Doctors Consortium on TV is going to go way farther than any other kind of messaging that we can do. Is particularly when they do such astonishing work, and they flat out bring this up. They don't wait to be asked. They say there's a distrust problem and we're here to talk about it. But I think, the third thing I'm going to bring up again is we have to be speaking people's languages, not only other languages, but the languages that they speak.
Mm-hmm.
And, and I know a lot of, Jen, you brought up the AIDS work that you've done a couple of times. It goes right back to where we were then, right? Not being okay with just sort of talking to everyone in one broadcast, but spending time in communities, in churches, in schools, where people are, to get messages across to them.
Absolutely.
Does anyone else have anything they want to add on to that before we keep going? I think that summed it up really well.
Well, I mean, I one of my favorite books in the whole wide world is Piece of Journalism, is And the Band Played On. And, I reread it constantly just because it's
why I went into public health.
Oh, really?
Yep, I read that book and went to public health school.
I saw the movie version.
You're younger than
It's one
me.
of the finest long-form pieces of journalism I've ever read.
Yep.
And, one of the things that I keep taking away from it is that there was an understanding from the beginning that you can't have a one-size-fits-all message.
So there are a lot of questions that still remain for this pandemic. How are we going to distribute it in the months ahead beyond some of the early groups that, state plans corresponding with national plans? There's questions about whether it could really prevent transmission or just the side effects or the, response to the coronavirus. So my question for all of you, but particularly for Tom and for Wendy, what's on your minds on the horizon now? What are you thinking long-term will be the major stories? It's so hard to predict, but try anyway.
I think it's vaccine. Beyond that, reminding people not to get complacent in the meantime. I mean, I think that should be obvious. You see these numbers skyrocketing and hospitalizations rising again. And I really, I don't know. I mean, a lot has been said about the bad messaging from the White House, and that certainly played a role. But people seem to have this idea that, oh well, it's okay if only I just do this, or only if me and my neighbor do this. And there seems to be a sort of a lack of numerical literacy. People just don't realize that all that adds up. I mean, exponents have a way of coming back to bite you before you realize it. And the more we can say that, the better. I think going back to something Wendy was talking about earlier about clear messaging, another thing we can do is to avoid and the media have not always been good at this in the past, but it's gotten much better, is to avoid the trap of both sidism. And that is true in many areas of science. Like if you went back 20 years ago and picked up the paper, who would say, oh, global warming, some people say it's true, other people say it's not. Well, the people who know what they're talking about say it's for real. So let's ignore the other people, not ignore the other people, but you know what I mean? You couch it in a way that accurately reflects the bulk of scientific evidence. Same thing with, even evolution. There was that big famous court case in Pennsylvania years ago about whether or not a school board could mandate certain teaching. And now, of course, with vaccination and, we could easily, oh, actually, this is a good example. The other day, there was a congressional hearing and some congressmen invited several physicians. I mean, you can always find someone with a degree to say anything. And it was on the advisability of whether we should be using hydroxychloroquine to treat patients with coronavirus. And I'm baffled by that. I don't understand it. And they brought in this other fellow from, I think, the Brown University School of Public Health and medical school, I'm sorry, Ashish Jha, who really knows what he's talking about. And he said, why are we talking about this? Like he just couldn't understand. And he was sort of brought into this debate about something that was not even a debate. So it's, I don't know why I bring that up, but it can be frustrating.
I don't think people realize that's a thing, that, you know, for many years in journalism, we were kind of trained to look for both sides. And thankfully, we're getting out of that now, especially when it comes to vaccines. The official NBC policy is there is no other side to vaccination. And climate change and vaccination are settled. But the one other thing that, you know, that you made me think of is, you know, as we're looking forward to 2021, my focus is on budgets. And what is this going to do to the government budgets that fund our public health programs? And what long-term damage are we wreaking? You know, and we have to deal with what's in front of us. But, you know, I'm really worried about what our city budget's going to look like and what our state budget's going to look like.
I know we're nearing 5 o'clock here. I was hoping to just kind of go around the horn, sum up how you're feeling right now. Are you kind of optimistic? Are you feeling as sobering as ever in the state of things? And what should we keep our eyes on in the months ahead? And we could start with Mike on that.
Are we supposed to be optimistic here? You know, I'm not going to lie. I think that there is a lot of darkness before the light at the end of that tunnel. The next couple of months are going to be really, really hard. We're going to see a lot of issues with our healthcare system, and those are going to reverberate for years. And there's so much that we didn't do that we could have. And I think that's the frustrating thing, having been, you know, standing there screaming, there's a train coming, and everyone's just sort of standing in the tracks, throwing the football around. And, you know, now the train is here. But there is a light at the end of the tunnel. I think that we have a lot of things that we need to deal with the distribution for the vaccine and getting into people's arms and getting the messaging around that. But we've been having these conversations, and I think that we're going to be successful in that.
Jen, you want to take it next?
Yeah, I mean, I think I probably feel the same as Mike. I tend to spin more positive, I think. I've been having this theme of sort of pandemic silver linings, sort of partly to keep my family out of despair and myself out of despair, and now it's come up. So I think, yeah, it's going to be a horrible next few months. I said today to a friend, I would like to crawl into bed, put the covers over my head, and wake up on April 1, but we don't have the luxury of doing that. Like you, Wendy, I think a lot about, because I'm a policy person, what this means for budgets for the public schools. You know, we talk about the restaurants, which is horrible, but every beverage tax dollar that they don't get then doesn't go to the school system. So I think a lot about Philadelphia and other cities, and what happens next. But I also think that, I don't know, I have some fundamental core belief in the resilience of, particularly of cities and populations. So I think we will, I mean, I wouldn't have been saying this if the election had gone a different way. Let's be very clear. I think we will pull it out, and I think it's going to be hard, and then we'll recover from this pandemic, and then we will have other stages of recovery that we will need to do. I hope we take lessons. I think we've learned a lot, and we're too much in it to even know everything we've learned. I really hope we will have some time to breathe and step back and take a lot of the good things we have learned and bring them to bear as we move into the next few years.
Great. Wendy?
I'm going to start by seconding everything Mike and Jen just said. I think that one other angle I'd like to bring up is one reason for optimism, and I also kind of spin positive, so I look for reasons to be optimistic. You guys should know that in this time, the city's newsrooms are learning to work together better than ever. And, you know, both Tom and I, our newsrooms are part of a group called Resolve Philadelphia that is focused on getting journalists to work collaboratively to answer big problems. So that makes me extremely optimistic, because I think getting rid of competition and the idea that, you know, for some reason, you know, journalists are competing with each other would be very healthy for the world, not just for journalists. I do think that I agree with Jen, we've got to make sure we learn the lessons that are in front of us, especially about communication around public health. I'm going to make sure that my team is more ready to cover the next big story because we don't think this will be the last one.
And Tom, what do you have first?
I think I share the cautious optimism, and I also am constantly sobered by the very real motivations that people have for wanting it to be over sooner than it probably could be. I mean, the economy, the toll on the economy has just been devastating, as we all know. Places that have never seen a food bank line ever, or have cars lined up, people just needing food, and they're not able to get tips at restaurants if they work at restaurants. They're not able to do any number of other things that would normally bring them revenue, and so that's a powerful motivation to try to return to normal sooner than we should. I don't know. I know we'll get through it, but it's going to be rocky. And I think that we could not, as Wendy said before, we couldn't do it without all of you getting the message across. So thank you.
Just want to make a quick note on a couple talks we have coming up at the Dornsife School of Public Health. Tomorrow we have healthcare access for Latinx non-elderly adults in the US, and we have 2 fasting talks next week. One, a seminar on women in statistics led by Dr. Leslie McClure, and a discussion of how the election results may influence public health and the Affordable Care Act and so many of those other issues, and that's moderated by our Dean, Ana Diaz-Rue. I want to thank our panelists, of course, for joining us today. Wendy Warren, Michael LeVasseur, Jennifer Kolker, Tom Avril, and of course, all of you for joining us today. Thanks again.
Good to see everybody. Thank you.
Have a good night.